All right, great. Well, the numbers are kind of slowing down, so I will get started. Good afternoon, everyone, and welcome and thank you for joining the call today. We're really excited to share an overview of the new data sharing agreement, the IZ Gateway Multi-Jurisdictional Vaccine Provider Jurisdictional Data Exchange Agreement, which is a mouthful. So we're mainly going to talk about it as the PJA. So you'll hear us say PJA a lot, but it's a lot quicker to say than the full agreement name. This is a really exciting development as it's going to help facilitate federal agencies, including the Veterans Health Administration and other multi-jurisdictional provider organizations, share immunization data through the Immunization Gateway to IIS. VHA has been a great partner for us, and we're really excited that they're going to be sharing data with IIS through the IZ Gateway. And the PJA is an essential component for any IIS looking to exchange data with VHA. So, we've got a kind of a broader legal framework that supports data exchange through the IZ Gateway that we're going to talk through in detail. And the PJA is the kind of new agreement that's kind of an essential component for exchanging with the federal agencies. So VHA and 6 states have already signed the PJA, which we're really excited about. This is a new agreement that came out about a month ago. At this point, so we feel like we've had some great progress. And again, today we're going to dive into the details and talk through all the meat of that agreement and hopefully answer any questions folks have today. So throughout the presentation, we'll stop, see if there's questions coming in, transition points, and then again at the end of the presentation, we'll have plenty of time set aside for questions. Before we jump in and keep going, though, we do have a colleague from the VHA on. I just want to turn it over for a few quick introductory remarks, and then we'll dive into the meat of the program today.
Excellent. Thank you, Kory. So good afternoon. My name is Jenna Yost. I'm the project manager for the VA business team. I'm here supporting Pam Belperio and Tin Wong. And on behalf of the VA, we really want to thank you for your time and your effort supporting this project. And we truly appreciate the opportunity to work closely with each of you. So to date, the VA has signed the PJA and development work is currently underway. And it's also important to note that the project is a very high priority for the VA secretary. So again, we're very excited to work with you. We're very excited to be here. We appreciate your help and support. And thank you for giving us the opportunity to speak briefly. Appreciate it.
Great, thank you so much. All right, so let's dive in. So, like I said before, the purpose of this webinar today, right, is to review the information needed by party to support the execution of an agreement required to exchange data with the Department of Veterans Affairs and other multi-jurisdictional provider organizations, right? And again, that is the PJA. That's going to be the kind of meat of what we talk about today. But also to kind of help folks who are less familiar with the IZ Gateway, we're going to provide an overview of the kind of current state of the IZ Gateway and the use cases that are enabled. We'll talk about some of the security considerations and jurisdictional controls that exist within the IZ Gateway. And then we will go into a deep dive on the IZ Gateway legal framework and deep dive on the PJA. And then again, we will do questions and answers at the end of all this. So that is the agenda for today that we're going to run through. Just we'll flash through these quick. These are the speaker bios. The materials are all available on the NPHL website. You can study the bios more closely at that point. But I think really important thing, right? I forgot to introduce myself. I'm Kory Mertz. I'm part of the IZ Gateway team, focusing more on the programmatic side of things. And then we have our great partners from NPHL who provide legal support and guidance to the IZ Gateway team. And Chris will be representing NPHL today and giving you the deep dive on the legal framework and the PJA. So again, all these materials and the bios are on the NPHL website, so you'll be able to get this in a recording of the webinar there. So at this point, I do want to just kind of start the overview of the IZ Gateway to get everybody kind of that ground floor understanding of what the gateway is today. So the IZ Gateway is a cloud-based message routing service that enables immunization data exchange. It offers a consolidated integration hub for data exchange, along with standard onboarding and testing processes. And I think an important note for this group is that the IZ Gateway has a really well worked out policy framework that enables immunization data exchange through the IZ gateway, and again, with a variety of partners like federal agencies like the VA and others. So again, it's kind of three things, right? It's the technical infrastructure, which is the message routing hub, right? The second component really is the kind of onboarding and some of the other kind of centralized stuff that happens there. And then the last piece is that policy infrastructure, which I think, as we all know, with data exchange is a super important component. Sometimes people just focus on the technical side, but we all know policy is just as important and essential to make this stuff flow. So as I noted earlier, right, the IZ gateway is really a message router that's focused on enabling more complete patient information histories to get to IIS, and for providers and consumers to better be able to access this information. One of the really important things to stress, right, that the IZ gateway is not, it doesn't store data, right? It's really it's not a message repository. It's just a pass through to get this data from point A to point B. And another thing the IZ gateway does not do today is it does not send in data to CDC repositories. So now, as you kind of think about the IZ gateway today, enables three use cases. And this first use case that's up here is really the core focus of today and the one that the PJA relates to. But again, kind of want to talk you through all three use cases, because I know it could be helpful in just kind of understanding the broader perspective of what the IZ gateway does. So this first use case, right, is exchanging data with vaccine providers, right? So here, right, you have organizations like federal agencies, they're multi-jurisdictional vaccine providers having bidirectional exchange with IIS, so submitting vaccines and querying for vaccine history information. And again, that is the kind of central focus of today's conversation. Do want to note the other two use cases, though. The second use case is exchanging data with other IIS. So two IIS can exchange data with one another, and really this is kind of driven by address information. So if a patient goes to a different state, but their home address is in another state, the kind of IIS systems are able to kind of automatically recognize that and push the data to the kind of home state IIS. And then the third use case is sharing data with patients, through patient portals and other types. So again, the second and third use case, not the focus of today, but I find it's helpful for folks to understand the kind of full breadth of what the IZ gateway can do today. So here we have a data flow diagram that depicts data exchange amongst the partners. So starting on the left-hand side, right, you can see the multi-jurisdictional providers. The data goes to the IZ gateway and then to the kind of relevant end IIS destination. The IZ gateway is a cloud hosted by the Association for Public Health Laboratories, or APHL, and APHL hosts this infrastructure on behalf of the CDC. And again, the arrows are double-sided, right? Because the IZ gateway both supports VXU, or vaccine reporting messages, going to IIS, and then the kind of acknowledgements that come back, and also QBPs, or queries for vaccine history, and the kind of related responses that come there. The other really important thing to note here, right, is that this kind of right-hand diagram that you see on this slide, right? This diagram is depicting the existing data exchange relationships that IIS have with providers in their state, and it's really important to note the IZ gateway is not trying to kind of replace that existing connectivity, those existing functional relationships, and the existing agreements that enable data to be exchanged there. The IZ gateway is really kind of focused on non-connected data sources and not kind of replacing existing connectivity that IIS have. So I want to kind of run through the highlights of the policy requirements for the use cases, and we'll start with the first use case, right? So the kind of core policy requirements here, right? First is the APHL data use agreement has to be signed, and most jurisdictions have already done this, right? It's kind of the core element that you're going to see in all three of the use cases. Next is the multi-jurisdictional vaccine provider IIS data exchange agreement, or the PJA. which again was released last month, and is we're going to kind of talk about in a lot more detail here. These are the kind of key elements to enable this vaccine administration information and vaccine queries to be sent to IIS and from vaccine providers. So those are the core kind of policy requirements for that use case. For the second use case, which is again is the IIS to IIS data exchange. The kind of other element that layers on here is the interjurisdictional MOU, and then again, organizations have to complete the APHL DUA and sign the share task order to support IIS to IIS data exchange. And for the third use case, which again is the consumer access use cases, IIS have to sign the APHL DUA and the access task order. So next, I'm going to run through some of the security requirements. So one of the key things that's really important to keep in mind, right, is that the way the IZ gateway has been constructed. IIS have control of how they interact with data exchange partners through the gateway. IIS choose the use cases that you will participate in and which partners you will exchange with. You have to set up or enroll data exchange partners in order to receive data from them over the IZ gateway. So again, really important take-home message. Your jurisdiction is in charge of who you're going to exchange data with over the IZ gateway. And similarly, data security we know is really important. And data is encrypted while in transit, and neither APHL, which again hosts the IZ gateway infrastructure, nor the IZ gateway itself collect or maintain PII. The IZ gateway conforms with all of the policy framework security standards included in the agreements. So all the kind of security requirements in the DUA, the MOU, and the PJA, the IZ gateway follows all those. So that is a quick overview of the IZ gateway use cases and what the IZ gateway does today. Obviously, if you have kind of additional questions, it would be helpful to dive into, we can do that. But now I'm going to hand it off to Chris to dive into the legal framework and get into the details of the PJA.
Great, thank you, Kory. That was really helpful. I'm Chris Alibrandi O'Connor. I'm an attorney with the Network for Public Health Law, and we are the legal entity, I guess you could say, who were pulled in to help draft the legal agreements for the data sharing here. And there are three different legal agreements that shape this whole legal framework for the IZ gateway. Carrie, go ahead. Next, Kory, next slide, please. Go back one. So yeah, so it all starts with, and this is a graphic that really builds off of the same one that Kory was showing you earlier. At the heart of it all is the IZ gateway, and it is through the IZ gateway that all of the data passes. Go ahead, next slide. The parties that are on the right are the various jurisdiction, state or territorial immunization information systems, each jurisdiction's IIS. Those are the parties on the right through which their information will pass in order to get to the parties on the other side and vice versa. As Kory was talking about, it's bidirectional. So the parties on the right there are the individual state or territorial or such jurisdiction, IIS, and the parties on the left are the federal agencies that either are participating or are expected to participate, such as the Veterans Health Administration, the Department of Defense, Federal Bureau of Prisons, as well as the so-called non-traditional vaccinators, whether it's a skilled nursing facility or a long-term care entity. So go ahead, next slide, please. Those are basically the parties. Now this somewhat confusing slide, but we'll take it slow, represents or shows the various legal agreements that overlay the parties. So we'll start with the one on the bottom there, the APHL, the American, the Association of Public Health Laboratories Data Use Agreement. You'll see that's connecting the IISs on the right with the IZ gateway. And that, as Kory was saying earlier, is the baseline legal agreement that allows the IISs to pass their data to and through IZ gateway. So that the data use agreement is an agreement entered into between each individual IIS and the IZG and the APHL. Now, over on the right there, the memorandum of understanding, that's the legal agreement we'll talk about again in a bit, that is entered into between the IISs and allows them to identify which parties it wants to share its data with. I believe over 50 jurisdictions have signed the MOU and are participating with that. And then the agreement on the top there, that's going to be the major focus of today, is the multi-jurisdiction provider / IIS jurisdiction agreement. Again, you can see why we call it the PJA for short. And that's the agreement that governs the data sharing between the IISs and those parties over on the left there, those federal agencies or other multi-jurisdiction vaccine providers. I'll mention, well, I'll get into more detail about these other two agreements later, but you'll see that in order for those on the left, those federal agencies and non-traditional vaccinators, they also enter into agreements in order for them to be able to share. It's the equivalent basically of what the IIS has signed, that DUA that the IIS has signed to share data with the IZ Gateway. The federal agency or these non-traditional vaccinators also sign a legal agreement, whether it's a memorandum of agreement with CDC, if it's a federal agency, or it's a BAA, if it's the non-traditional vaccinator for that use case of provider to IIS. We'll go into more detail about that, but we just wanted to start off with like the big picture of what all of this is. And I'll point out that the prior state, the whole purpose of this PJA is that currently for the Veterans Administration, for example, to participate, through the IZ Gateway and exchange data with the IISs, they would have to sign up to 64 individual IIS agreements. And what the PJA allows for is that those federal providers and the jurisdictions can sign this one PJA in order to participate in that data exchange, which certainly relieves the burden on the part of the federal agency to not have to sign 64 agreements. And for each individual jurisdiction, IIS, it relieves the need to sign some kind of data use agreement or data exchange agreement with each of the multi-jurisdiction agencies on the left that will be participating or that they want to exchange data with. So the goal of this is to create, diminish the administrative burden. Okay, next, please. That's one goal. So we'll do a quick, this is again, the baseline agreement, the data use agreement that was on the bottom to the right on the graphic. This is the data use agreement that IIS has signed with the APHL. It's required for participation in all use cases that Kory was referencing, 1, 2, 3. The purpose is to facilitate exchange of immunization information through the IZ Gateway. As Kory referenced also, the security provisions, there's calls for compliance with FSMA, HIPAA, FedRAMP. And this is the agreement that has Appendix A, and that's the task order that allows each jurisdiction to select which of the 3 use cases it wishes to participate in, sharing data with IISs, sharing data with the parties on the left, those multi-jurisdiction federal agencies or other multi-jurisdiction vaccination providers, or the 3rd use case with the consumer use. Let's go ahead. Next slide, please. So again, now we're just that was the agreement there on the bottom there, the data use agreement. Now we're going to focus on that agreement at the top there again, the provider jurisdiction agreement. Next slide, please. So here we go for the deep dive. So this agreement is, it was modeled, so this is again, the agreement between the multi-jurisdiction providers with the IISs, individual jurisdiction IISs. The agreement was modeled after that interjurisdictional MOU, which many of you likely, your jurisdictions have signed, one of the 50 or so that have already signed it. It was based on that. It was created as a result of, or after having reviewed 15 jurisdictions, particular IIS related agreements to inform the development of the PJA. Again, it's intended as a multi-party agreement to streamline the number of agreements that each entity needs to sign. We put out a draft of the PJA to the IISs and received for review, and we received feedback, which again informed the final version of it. What folks probably know, certainly from Gina having spoken earlier, is that the Veterans Health Administration has signed on and is going through the onboarding process now, as well as I think Kory was saying that 6 IISs have signed on. So the process has started and moving. Go ahead, next slide, please. Okay, so going to the parties of the PJA are those, again, the parties on either side of the graphic, the multi-jurisdiction vaccine providers and the individual IISs. And the purpose, again, is data exchange of immunization information through IZ Gateway. Again, it's not a data lake, it's a passage through. Specifically immunization reporting and immunization query consistent with applicable law. Next slide. And it does, we've kind of highlighted a few of the key terms in the agreement, just ones that people have often had questions about, and I'm happy to answer questions that people have later for sure. One key term is that it does not in any way prevent other communications or agreements that IISs may wish to enter into outside of the IZ Gateway, does not limit an IIS's ability to enter into agreements to share that data with other entities specifically. Applicable law for federal entities, they are subject to applicable federal laws only, but otherwise all applicable statutes and regulations of the state or the jurisdiction, including federally recognized tribal governments and U.S. territories in which a party operates, as well as all applicable federal statutes, regulations, standards, and policy requirements do apply. Next slide, please. Okay, so data exchange, again, it supports 2 types of data exchange, both the push of immunization reporting, reporting that's going out to the provider, the providers pushing out the information of what vaccinations have been given to a jurisdiction, and query, provider querying 1 or more jurisdictions via the IZ Gateway, and 1 or more jurisdictions providing information to the provider that's making the query. And again, as Kory was mentioning, each party determines the information it provides to another party. The DUA calls for that. The PJA that we're talking about now calls for that also. So within the legal agreements, it is, it's part of the legal agreement that's entered into that documenting that each party gets to determine the information it provides to another party. And then it is in the onboarding process is when through that process, the actual selection is made of which jurisdictions each party wants to share its data with through the digital certification process and the onboarding. Next slide, please. So a few more terms here. Again, these terms are modeled after the MOUs language, the language of the Memorandum of Understanding entered into between the IISs. Immunization information is information created by a provider or created within or received by an IIS that relates to past, present, or future immunization status, the provision of vaccine to the individual, and medical or clinical information related to the immunization. A key question we've certainly been asked and reflected in this key term is that as far as the incorporation of data, the receiving party, consistent with their applicable law, may incorporate data into its data system, whether it's your IIS or clinical records. And again, consistent with applicable law, the data is subject to the receiving party's control, use, and disclosure. And as with, under HIPAA, certainly, the receiving party is responsible for the protection of the data. Next slide, please. So this next, we have some key privacy and security terms. Again, these are not all of them, but some key ones are By signing the agreement, a party is affirming that it will implement or has implemented confidentiality policy consistent with applicable law, will implement appropriate administrative, physical, or technical safeguards to protect privacy and security, as we see language from HIPAA. All reasonable efforts to implement industry standards for information security. We point out that HIPAA is the floor for providers, and the federal agency providers must comply with applicable law. There is a little additional breach notification language that was requested by a couple of IISs, and that is that upon discovery, a receiving party, a party that has received some data, upon discovery that there may have been a breach, that receiving party is obligated to make reasonable efforts to identify the source of data that was received through the IZ gateway, that was the breached information that was breached, and to notify the sending party and administrator. Again, the standard there is reasonable efforts. So next slide, please. This is just kind of a smorgasbord of typical agreement clauses that you would see. Governing law. There is the withdrawal and termination terms are laid out in section 25. And I mentioned, go down to the bottom there, that period of agreement. There is no fixed term to a party's engagement with the IZ gateway per this agreement. And so a party would just be, need to follow the withdrawal and termination terms should it choose to cease involvement. There is no monetary exchange in this agreement. There are no warranties other than best efforts. And there is there's a limitation on liability in that the parties are responsible for their own liability, and there is no indemnification called for under the agreement. So next slide, please. I'll point out, we know we've mentioned it already, but because this is a multi-party agreement, this is not the typical, two-party agreement where both parties will sign, everyone gets a, fully executed copy and we move on. Instead, because it's a multi-party agreement, each party signs on to it, and then the agreements are all kept and stored by the CDC. And I say the CDC because there needed to be an administrator of this agreement, again, because it's a multi-party. So the CDC, since it is the host of this effort and is sponsoring the IZ Gateway work or exchange of data, the CDC is the agreement administrator. And as part of that, its responsibilities include maintaining signed copies from all the signatories, maintaining the contact information and making any updates as needed, contacts that are called for in the agreement, receiving and providing notice required under the PJA, making accessible a list of all the parties to the PJA, as well as facilitating, addressing this training, for example, facilitating addressing any questions or concerns that come up. And also the CDC is responsible for all clause 26 up there, the notice requirements. Next slide, please. So we recognize this has been a lot of information, but we are happy to answer any questions. And Kory is going to handle the questions from here. And then there's actually another slide that will eventually come up that gives you contact information if you've got follow-up questions. And with that, I will be done. Thank you.
Great. Thank you, Chris. And thanks everybody for joining us today. So at this point, we will open it up for questions and answers. So there is the chat box and the Q&A box at the bottom of the screen. So feel free to go in there and add in your questions. So the first question that came in, Chris, is there a deadline for executing the PJA?
No, there actually is not a deadline for executing it. Certainly the CDC is hoping that people will quickly get on with signing the agreements to start up with the onboarding process, but there is no deadline for signing the agreement.
Great. Yeah, and as we mentioned earlier, 6 states have signed. So folks are moving ahead and have reviewed the agreement and signed off. Again, the purpose of today is to answer any other questions you have about the agreement or anything else we can do to help as you kind of review and consider the consider the agreement. Next, we always get the questions of the slides. I mentioned it earlier, but the slides are posted on the NPHL website. The recording will be up there as well, so you'll be able to, you can review all this information and get these useful slides on there.
It may be worthwhile, Kory, to mention too, that for folks that if you have not received the agreement yet, an email went out on January 14th. Is that referenced in the slide? I don't remember. Yeah. Sorry.
No, go ahead. Just keep going.
Oh, so an email was sent out by CDC and Audacious and Kory, I believe, which had not only the agreement, but the sample agreement for you to take a look at and sign if ready, but also a crosswalk between the data use agreement and the this PJA, so that for the lawyers who are having to review the agreements, it's kind of a helpful showing you how the various topics are covered under both. It was a useful exercise performed by one of my colleagues, Carrie Waggoner.
Great, thanks, Chris. Yeah, and just while we're on that point, if folks have, if after the webinar ends and you have other questions that come to mind that you didn't have a chance to ask today or didn't feel like you got the kind of full answer as you kind of go back and consider the agreement in more detail, please do send those questions to the email up here. So izgateway@cdc.gov. That's the best place to kind of send them in for us to track them and make sure you are getting the correct information back. The other thing I will know as we wait for additional questions to come in, we do have one more webinar in the series. So on Friday from 2 to 3 Eastern, we will have the last webinar in this series. So, if some folks learn best by hearing things multiple times. So if it's useful to hear all this again, there is that opportunity. And again, the recordings are posted on the website as well on the NPHL site. So we got another question in the Q&A, and it is, which law will apply to data in transit?
That's a good question, and I recognize the person asking. Hi, Socrates. It's a good question. So we already know, the agreements are very clear on it's the data on the receiving party. The receiving party, once received the data, is subject to their applicable law. I don't know the question. I don't know the answer to that question, actually, Socrates. It was something that I wondered about myself. So I will get back to you with an answer to that. I know that if Carrie Waggoner was on the call, she'd know the answer to that. But I haven't been as involved as she has been in all of the inner workings of this IZ Gateway. So I will get an answer to you on that. Thank you for asking.
Great. Okay, we got a few more questions coming in through the Q&A. So follow up from any thoughts on pursuing a formal interstate compact? Ooh, those are always fun. Chris, any thoughts?
No, no thoughts.
Okay. All right, we'll go to the next one. Is there a specific IIS product or system that jurisdictions must use in order to establish the IZ Gateway connection? So I can take this one. And so no, particularly as you're thinking about, so remember there are the 3 use cases, right? So for this kind of initial for use case 1, which is the exchange with multi-jurisdictional vaccine providers, your system really doesn't have to do any changes. For the kind of IIS to IIS data exchange, there are some changes. Most of the vendors kind of support those. But again, for the kind of purposes of this conversation and the use case that the PJA is focused on, there are not any kind of technical changes per se that your IIS system needs to make. So hopefully that helps. And if there are more kind of specific details to that, again, please shoot us an email and we can dive in on that. And most of the kind of states have done the baseline onboarding, and connectivity testing. But again, if there are specific circumstances in your state that it would be, or your jurisdiction, sorry, that it would be useful to dive in on, please let us know, and we will get back to you on that. All right. Yes. Okay. Of course. Yeah. And again, like we're you know, the point of these webinars, and we're kind of always in our outreach try to help answer questions, make sure we're kind of going over everything. You know, recognizing people come to these calls with kind of different backgrounds and experiences with these things. So again, happy to have offline conversations as well, to hit on anything that we didn't go into enough detail on today as well. So, okay, great. The next question, so, and this is kind of along the lines we've gotten in a number of these webinars, but you know, we know that in some states, their immunization laws restrict how they can share data with providers, and we've kind of gotten that question a lot on kind of state-specific circumstances. Chris, anything you'd want to kind of share on how that works and how we've kind of approached that with states that have kind of very specific, be it consent or other requirements that they have in place?
Again, you know, as part of the legal agreements allow the parties to determine with which other entities they wish to share the data. And then the technical process of, it's through the technical process of onboarding that the jurisdictions actually do make those choices. So for example, there's one state that is, one state's IIS requires it to only share data with other entities, other IIS, for which every participant is allowed to opt out of having their data shared. So in that instance, that state would then be able to, you know, determine which are the states that don't meet its own IIS regulatory requirement, and then just not share with those particular, you know, other jurisdictions or states. So that's how I think I'm answering. I hope I'm going to the point of what you were asking, Kory, which is that's one example of how exactly the states can control making sure that, you know, your state law or your jurisdictional law can be abided. And it's through that process that you get to do that. Was there any nuance?
Oh, no, the other thing I was just going to add, you know, if you have very kind of state-specific issues like this, because again, I think we've heard this come up in some of the opt-in states and in other circumstances, we are happy to have follow-up conversations and dive into the kind of nitty-gritty specifics of your state law as well. So, all right. Any other questions that folks have today? One other one that I'll just hit on that I know has come up in some of the prior conversations, and I think we've hit this theme a few times, but I know people, you know, we've heard it on multiple of the webinars. So I will just mention, folks have had questions about, you know, if you participate in this process, can you choose which federal agencies you share data with, or is it kind of an all or nothing thing? And again, as Chris just said, and as we've kind of, I think, repeated throughout, you know, again, it's really up to the jurisdictions are kind of in the driver's seats of deciding which organizations they exchange with. So that same thing would apply with federal agencies as well. So, okay, let's give folks another 30 seconds or so to see if we have any other questions. Chris, was there something you wanted to add?
Yeah, just to say that it's possible that I may get an answer back from the colleague I mentioned before, Carrie Waggoner, on Socrates, on your question about what law applies to data in transit. If it comes in, I'll wave my hand and let you know. If not, as I say, I'll follow up with you.
Great. So yeah, so let's give folks a little bit more time to see if any other questions percolate up. Otherwise, I think we will wrap up here soon. But again, I want to pause and see if folks think of anything else. We still have more time, so always happy to answer more questions if folks have them now. But again, do want to just reiterate while we're waiting to see if other questions come in. If you have stuff come up after this, please do email us at izgateway@cdc.gov. After the webinar ends, there is a short survey that will pop up. We would love if you would fill it out. It just helps kind of inform how things went and helps us refine this for the additional, well, I guess the one additional webinar at this point that we have on Friday. But it's super helpful to get that feedback and to kind of use it to inform our future educational sessions. And again, that last webinar, as you kind of see on the slide, is on Friday from 2 to 3 Eastern. All right, not seeing anything else coming in the Q&A or the chat. Unless Chris, you have anything else, I think we may wrap it up for today.
Yep.
Okay.
Nothing. Thank you.
Well, great. Well, thank you again, everyone, for joining us. We're really excited to have the PJA out there. If you have any additional questions, like I said, that come up as you're kind of reflecting on the agreement or this webinar, please do shoot them over. Again, join us for the webinar on Friday. And with that, again, I will just thank everyone. Thank you for your time and for your partnership on this really important work. Thanks, everyone.